Hey everyone, and welcome to Chef AJ and Friends. I'm your host, Chef AJ, and my guest today is Dr. Katie Cruz. She is a clinical psychologist practicing at Beautiful Minds in Auburn, California, specializing in trauma treatment. And she's also one of the hosts of a wonderful mental health podcast that I highly recommend called the Brain People Podcast. Please welcome her to the show. Hello, and thanks for coming on.
Hi, it's wonderful to be here.
Yeah, I'm so excited to have you on the show because I love your podcast, especially when you're one of the four.
Yeah,
Yeah. So many questions about trauma. Do you want me to just dive in, or is there anything you'd like to say to introduce yourself to our audience before we get started?
I think you captured the main things. Whenever you talk about trauma, it's like I need to maximize my time because there's so much to it. So I'd love to jump right in.
Absolutely. Okay, so what is trauma?
So, what is trauma? It's really a complex question to answer, and you'll even see many different definitions. I often, when I talk about what is trauma, I like to talk about what it is not, especially in even in our mental health field of having an incorrect diagnosis. So, in thinking about what we typically think about trauma, and then I'll talk about what it is we think about PTSD. And a lot of times in the media, in even what we see on movies, it's typically focusing on PTSD related to combat, to veterans. And so a lot of times we think what is trauma is we think it's it's a cute event, one time event that leads to a very kind of dramatic and obvious symptom presentation like flashbacks or nightmares. But when we think more in depth about trauma, including some certain researchers, including Dr. Judith Herman, who's expanded that to include complex PTSD, not just PTSD, we realize that one, it's not just an acute event, one time event. It can be multiple events. It can be chronic. It can be sometimes we think about typical events like combat, or it can be atypical events like childhood neglect, medical trauma, right? Things that happen outside of the war zone that we typically think of. And then I like to highlight that there are different types, including type B, which is bad things happening to us, versus type A, which is the absence of good. So when you think about childhood neglect or childhood trauma, many times what is trauma for them is the type A, where they don't have the nurturing and the care and the attachment that's needed for their healthy development. And so, really, it could be, I could go on with regard to this answer, but when we think about trauma, we have to get outside of the PTSD veteran combat mentality, and we have to expand it to really what even some researchers or trauma therapists like even Dr. Peter Levine or Dr. Gaber Mate, who talks about it's really on a spectrum. So, what is trauma? Trauma is very complex. It could include the spectrum from acute to chronic. It can include typical events to atypical events. It can include bad things happening. It can include the absence of good happening, childhood to adulthood. It's quite comprehensive in its nature. And what I would say, then taking all of that together, is the way that I like to define it. And Peter Levine also highlights this. It's really the rupture of relationships. And I would be curious, Chef AJ, if you've heard of this definition before and what your thoughts are about it. But the rupture of relationships, number one, the rupture of relationship with other people. That's the most obvious. When someone's done something to us that can rupture our relationship with others, it could be rupturing the relationship with the world. It could be rupturing our relationship with God. That's a big component of trauma. And then the one we often don't think about is even the rupture of relationship with ourselves, where we ourselves are disconnected from our bodies, or we learn to blame ourselves or hate ourselves. So if I were to, after that long answer of what it is not, right, and what it includes in the complexity of it is, I would say at the core of it, it's the rupturing of all relationships.
Wow. Well, why isn't it talked about more? I mean, I think it is in some circles, but I'm in the plant-based world and you are plant-based yourself. And yet there seems to be an emphasis on the food, the food, the food.
Yeah, it's often not talked about it. And actually, when I do a lot of presentations, public speaking, and I start with the question, why talk about trauma? And then the answer is because we don't talk about it, right? And so, why not? Why don't we talk about it? And some of the main points I often highlight is one, we think it's a delusion. There's a delusion of the minority. We don't talk about it because we think only a few people are actually suffering from trauma, but it's actually the majority. And what's quite fascinating, you look at the statistics of childhood and adulthood trauma, and it really is the majority. And I could, rattle off some statistics, but because we think it's minority, we just stay quiet, right? Not a lot of people are dealing with this. Another reason is because if we have an incorrect definition of trauma, then we also think it's the minority. But then the other thing is the complexity of trauma makes us feel very uncomfortable. And I don't know if you've ever experienced this, but even with not even traumatic events, but you might share something with someone and they feel uncomfortable and they dismiss it, right? We don't feel comfortable talking about bad things. And in Judith Thurman's book, she highlights of trauma recovery that to really deal with trauma is to be to put ourselves in like face to face with human vulnerability as well as evil. And so it makes us feel uncomfortable, and so we don't want to talk about it. So whether we think it's just a few people, there's not a necessity to talk about it, or we think about it and it's so complex and disturbing that we shy away from things that we don't understand or that we don't feel comfortable with.
Thank you. How is it similar to PTSD? And is everybody that has PTSD, have they had trauma? How are they related and not related?
So think about trauma as the umbrella term and PTSD being kind of one aspect to it. So trauma in its just basic definition means wound. And so it's like, well, what is wounded, right? It's a psychological wound, yes, but it really is a whole person wound. Another part of trauma is we don't realize and recognize that it impacts even the body. But trauma is the umbrella term. PTSD is just a diagnosis, which this is kind of a side point, but in mental health, a lot of people they have these misunderstandings about these diagnostic categories or disorders. They're simply categories that really explain or capture symptomology, right? Different symptoms. So PTSD is just a category of different symptoms to explain what someone can experience after they've experienced trauma. So trauma, big category, PTSD, one aspect of that. And that's where I mentioned not too long ago that complex PTSD has been, taken much more momentum to recognize, oh, there are people that don't fit that category. PTSD doesn't fully capture their experience of trauma and their distress of trauma. So we're creating this other category to capture that symptomology and that distress. So trauma, big category, PTSD. So very similar, but it's just a manifestation of trauma. Some people can experience trauma and never have PTSD. Some people can experience trauma and develop complex PTSD, but not have PTSD symptoms as well.
Yeah, well, how can two people go through the exact same experience and one develop trauma or PTSD and one not?
That is a question that has a lot of different variables to it. And actually, it's quite complex when, yeah, just the reality of two different people, same experience. A great example of this would be 9/11, right? How many people were exposed to the trauma of 9/11? And they've done studies to look at, okay, who actually goes on to develop PTSD in that experience? And how come not everyone develops it? And so that's a question not only that you're asking, but that a lot of researchers have asked. And there are many other variables. Basically, one way to capture a lot of variables are some people are more vulnerable. So you might ask, well, what makes them more vulnerable? Prior trauma is one of those variables. If I've experienced difficult things prior to a specific traumatic event, I might be more likely to develop PTSD or trauma. Or sometimes we might say vulnerability of if I already have general mental health issues. In regard to 9/11, that after 7 to 12 months, they kind of restudied and relooked at patients or people who had been exposed to 9/11, only 4.7% of the cohort actually ended up having PTSD. So you ask yourself, well, what about the other, 95%? And one of the key factors, so I could highlight a lot of personal factors and variables that can explain why some people develop it and others not. But one of the ones I want to highlight is avoidance, is those individuals who avoided processing their trauma. They avoided actually trying to heal. So taking an analogy here, using an analogy here for a moment, if all of us got the same wound, but one of us, let's say you and me, let's say you had the wound, I got the exact same cut, but you cleaned the cut, and then you patched it up, you will heal and not develop PTSD. But then let's say I rub dirt in my wound, or I neglected, or I don't attend to it in a way that it gets an infection. So they call PTSD and other related disorders as non-recovery disorders, where we naturally can heal from trauma. But if something gets in the way of that natural healing process, like our body can heal itself, right? It's a beautiful, beautiful reality. And that's why actually we as clinicians cannot diagnose PTSD within the first month, because we expect it's natural and normal to have some of these PTSD symptoms, because our brains have experienced the shock through trauma. And it's important for us to then recognize, okay, that's normal, but it'll take some time for my brain and my body to recover. But if I avoid that natural recovery process, and this is a classic example of avoidance is addictions. The addiction gets in the way of processing it in a way that allows for our bodies and our brains to heal.
Thank you. What are adverse childhood experiences, and is trauma worse if we go through it when we're younger?
So that terminology, right, adverse childhood experience, ACE or ACEs, comes from a very popular study that was done by Kaiser. And it's quite fascinating when you study this study, because you wouldn't have expected a big hospital system to have done something like this, and it was quite enlightening and helpful for the trauma world and for those who have experienced trauma to bring light to this topic of adverse childhood experiences, where children have experienced adverse things, right? Adversity, but in a way that one of the highlights of the study was that these experiences can contribute to physical health problems. So again, from Kaiser, from a big hospital system where oftentimes the typical traditional medicine would only treat the symptoms or treat the obesity, treat the smoking, treat these physical health problems. They recognize that there's a connection between adverse childhood experiences in childhood that later gets manifested in these even physical health problems. And another part that I really appreciate about the study, I don't know if they purposely didn't use the word trauma, but they expanded the definition by looking at even other things, like if you had an alcoholic parent, if you had someone in the household that was incarcerated, and recognizing that these two atypical events, not combat, not just sexual abuse, but these other diverse experiences can and does have a really negative impact on the individual, both early on and later. Now, asking the question of, is it worse when we are young? Trauma is trauma. It's bad and really, troubling. But think about, from a brain perspective, the vulnerability of a child, the vulnerability of their brain, right? It's forming, it's developing. So of course, trauma, whether it's a physical trauma or even a psychological one, which we're highlighting, it would be extremely damaging to the formation of the brain. So maybe I can share a slide here to kind of demonstrate some points. And this is just from a presentation I give publicly. And it's part of a section where I emphasize the biopsychosocial spiritual impact of trauma. So this is part of the biological impact. And let's see here. Okay. Let's make this bigger here. So here we go. Can you see my
Yes.
slides okay? Perfect.
Perfect.
So in childhood, and this is coming from the Center of Developing Child at Harvard University, it talks about the lifelong consequences, the serious consequences, and of course, the negative consequences on both the body and the brain. So is it worse in childhood? Yes, especially with development. So these are some main areas that it impacts biologically, which we think, oh, of course, psychologically, oh, higher rates of depression, anxiety, and so forth. But I want to highlight a component that most people don't highlight is you see elevated and prolonged levels of certain hormones in the body, especially cortisol and adrenaline, which we know is part of that sympathetic nervous system, the fight or flight response. And that's really helpful, right? If we see a bear or a lion in a moment, but when it says prolonged levels, is that a child is having these hormones, cortisol, adrenaline, constantly pumping through their body. And then that is obviously linked to a lot of different things, but especially we see immune system changes, where a lot of these fancy words are describing a rapid aging that's happening in the body, a suppressed immune system. This is why even children who experience trauma can get sick more often. And not just I'm getting a cold, but later on even develop immune system and autoimmune diseases. But we see also just an ongoing wear and tear on the body. We see neurological changes. And this is really fascinating because there's just this imbalance as the brain is trying to develop. Well, if I'm in a traumatic situation, I need to be able to deal with that trauma. And so the survival parts of the brain, the emotion centers, are really strong. So there's strengthened pathways in that section of the brain. You see there on the picture, especially in the amygdala, the hippocampus, and it's trying to remember danger to protect you. It's very adaptive. But what also happens is that the prefrontal cortex is not as strong. It gets weakened. And already in children, that cortex, the prefrontal cortex and the frontal lobe in general, is not even yet developed. So it's already being stunted while it's not even fully developed. And so what we see later on with adults who have experienced trauma is these impulses, strong, intense emotions, inability to regulate their emotions. And that frontal part helps, or like the brakes to our emotions. So we have strong emotions without the brakes. So we're driving a really fast car without brakes. And then we also see epigenetic changes. So even on the gene level. And so this is just an aspect of the answer of yes, in childhood, it is worse. And many times part of why it's worse is because the children are vulnerable in their development, and these things are stunting development. And what's really like, now let me add another component of the cognitive part is a lot of children, because they don't have the prefrontal cortex to really think and reason well, if they're taught you're stupid, if they're taught, you are unworthy, you are dirty, you are broken, they don't have the ability to correct that thinking. And so there's a treatment called cognitive processing therapy that helps look at those beliefs and re-examine them now as adults.
Yeah, maybe you could talk about what that is and how it's different than CBT or DBT.
Yes. So CPT stands for cognitive processing therapy. And there are different waves of CBT. So kind of, if you think about CBT being like the mother, and then the children have been therapies like DBT and CPT, because the premise of CBT, one of the most evidence-based practices, so CBT, cognitive behavior therapy, has been widely used for depression, anxiety, OCD, insomnia, you name it, and it's been very effective. But one thing that CBT has often been limited in is it's very good for general purposes, but especially for trauma, it doesn't get to the root of trauma. And so CPT, cognitive processing therapy, has taken a lot of elements from CBT that have been shown to be very effective and have focused it in on the topic of trauma. And I have a whole episode on CPT with the Brave People podcast that goes into the details of it. But since we have a lot to get through for on the topic of trauma, I'll just give a brief overview. Is going back to these negative beliefs that we develop, and also going back to this avoidance thing we talked about, is in the book, The Body Keeps the Score, the author says this one line that's very powerful. He says, I don't remember the word for word, but basically the concept is that our greatest suffering comes from the lies that we believe. And so if you think about that in conceptualizing and understanding trauma, it's not just what happens to us, it's our narrative, what we believe of what happened to us. So let me give an example. When individuals have been the victims of sexual abuse is challenging, it's traumatic, but what really lends to the traumatic aspect of it is when people have certain narratives like, I'm dirty, I'm broken, or it was my fault. I've had several clients who carried the burden for years, believing that it was their fault. I didn't fight him off. I didn't do this. And that narrative is what's damaging. It's not just the traumatic event, it's the lies that we believe. And so CPT really focuses on identifying those thoughts, which we call them stuck points. They keep you stuck in trauma, stuck from recovering, and then we address them, we re-examine them because we often have believed them and we've never questioned them. Whether it's a medical trauma, right? Whether it's a miscarriage, those kinds of things, we have to re-examine those things and say, okay, is that true? And one thing, like if you think about self-blame, that's so traumatic or so difficult, is if we are really to blame, then we're the perpetrator. And we're walking around with ourselves constantly. So not only am I in danger if I say, oh, that man did that to me, but now I'm in danger everywhere I go because I'm to blame. So we want to overcome those stuck points. The other aspect of CPT that's not always necessary, it's the processing part of it that we have people write a trauma account or trauma accounts, helping them process the memory. Because a lot of times with trauma, we try to not remember the memories, but avoidance builds fear and a lack of confidence. And we have to realize, although that was very traumatic, it's just a memory. I'm no longer in danger. And so it's a way to calm our nervous system by helping us process what happened, why did it happen? And part of the processing is also expressing a lot of those emotions that have been stuck in our bodies. And in trauma therapy, in general, not for CPT, we talk about there's three main stages of recovery. The first one is stabilization, right? Seeking for safety and stabilization. The second one is mourning, right? Remembrance and mourning. And CPT helps with that by processing those memories in a way that helps us mourn, because trauma is very likened to grief. And then the last stage is reconnection.
So, do people that have suffered from trauma, do they also struggle with other mental health issues, maybe anxiety or depression? And if so, like which came first, the chicken or the egg?
Yes. So without a doubt, we see a lot of relationship between trauma, depression, anxiety, a lot of mood disorders specifically, but also other disorders. And what's really sad is that if you again look at these disorders, a lot of them are categories of symptoms. They're not talking about the root. Many times an argument against the mental health profession is like they'll say, "Oh, in medicine, we don't diagnose, we don't give a diagnosis as the symptom. We don't say, oh, you have the disorder or diagnosis of chest pain." No, we say that's a symptom. Well, what's the cause of it? And in mental health, we deal with a lot of symptoms. And so depression, anxiety, a lot of times are the symptoms. So chicken or egg, which one comes first? It's often trauma. Trauma is the root to panic disorder, agoraphobia, health anxiety, and so forth. And I've had a lot of clients who have gone through years of therapy, not getting better. I have one in particular that I'm thinking of because I just saw her this week. And she was in therapy, I don't know, for maybe 10 plus years, went to a lot of psychiatrists, and then finally came to my office. And it was very clear her depression anxiety was simply because she had complex PTSD. She had underlying trauma that had never, in the context of therapy, been addressed. And she felt so hopeless, as if I'm broken. The reason why I haven't gotten better in the mental health system is because I'm irreparable. And so I explained to her, you have trauma, and this is the approach. And we've been working together for several years now, and she's doing so much better because the chicken or egg, right? In this case, the egg is trauma. The root often is trauma. And if I had more time, I would go through examples of this, of like, how panic disorder, can be the symptoms of trauma and so forth. But basically, to answer it in a more succinct way, trauma is the root that often leads to the fruit of depression, anxiety, and other mental health issues.
But if it is the root, it seems like it would be important to get to the root rather than just treating it with medication or treating it as just standalone anxiety or standalone depression or panic
Yep.
disorder or things like that.
Yep, 100%.
So I remember when I think it was 12 years old, that was like over 40 years ago. George McGovern ran for president, and he chose as his running mate a senator named Thomas Eagleton. And then Thomas Eagleton had to step down because he had been treated for depression. So therefore, he was, how could he be run for president or vice president? Why is there still such a stigma around mental health and getting treatment for it?
So there is definitely historical roots to that, right? We have a long history of stigma, primarily because of how it used to be viewed. You're crazy, you're very stereotypical severe mental illness. And so we had kind of a catch-all. Depression's a part of that, anxiety is part of that, but it's a spectrum of severity. I would also say there are cultural elements to that. Different cultures have viewed mental illness in different ways. There's some cultures where even disorders like schizophrenia is like in Turkey, when I visited, I was so surprised that there are no homeless. And it's because they're a collectivistic, family-oriented society that, oh, you have mental illness, you stay within the family. We don't shame you. We don't, cast you out. Now, there's still maybe some elements of stigma there in its own form. But I would say a big part of that, not just the historical roots or the cultural roots, but we don't like, as human beings, things that we don't understand. And when we don't understand it, it makes us feel uncomfortable. And so we avoid. But the more that we avoid, the more we don't understand. And it keeps us in this cycle. This happened with racism. It's still happening with racism. Is they say how to overcome racism or other, stereotype types that we have that are prejudices against people, is we need contact. We need to talk with these people. We need to understand them. And so we have a lot of discomfort about what we don't understand. And sometimes people have this mentality, oh, depression, anxiety, mental illness is basically just a choice. So not only do you not understand, but you have misunderstandings that if you continue to believe that, you, as if they're somehow, they can contaminate you, you'll stay away. And I would say another part of that too is mental illness. Those wounds are invisible. They're not like a broken leg. They're not like a cardiac disease that we may be more familiar with. And so we maintain that stigma. Now, it is getting better. We have to be careful that the pendulum doesn't swing to the other side. There are some young people these days that are saying things like, oh, yeah, my therapist this, my therapist that. And they may be over identifying with their mental health issues. So we don't want, again, the pendulum to swing. But we need to find this balance where we recognize these are legitimate struggles. These are legitimate, you know, uh, impairments that people live with. And now, just because someone has that impairment doesn't mean that they can't hold office or they can't, live and function in their particular area. So we just have to better understand and not use as many labels. That person is bipolar. Oh, what does that mean? We need to talk and better understand one another to reduce the stigma.
Thank you. So, what exactly is trauma therapy? How is it different than just regular talk therapy or psychotherapy?
So I love how these questions go really hand in hand. So going back to, you know, is trauma related to anxiety, depression, is chicken or egg? Is if we understand trauma to be the root, then what distinguishes trauma therapy from other therapies is it's getting to the root. It's trying to help people really understand what is trauma. There's a lot of psychoeducation, a lot of understanding of their difficulties. Um, Trauma therapy is really important to process, address, and heal from that trauma. It includes many different aspects. It could be addressing the traumatic memories. A lot of it has to do with trying to learn how to regulate your emotions, regulate your nervous system. It tries to address those negative beliefs. Here's a really good example, maybe how trauma therapy would be different from just general therapy. Is CBT might say, "Oh, let's address any negative thoughts that you have. I was at the grocery store and I had a negative thought. I, everyone's judging me." It's like, okay, CBT would address that, but trauma therapy would not just address and try to change that superficial thought. It would help a client understand better how is that negative thought or how is that experience in the grocery store related to your trauma. Because again, a lot of different therapies, if we're just addressing depression, anxiety, these other things, it's staying on the surface. So if any of the listeners here today are struggling with mental health, I'd encourage them to, whenever they have a trigger or a situation, is ask themselves, is this potentially related to any of my past trauma? And so you're really, again, rooting all of your understanding about your mental illness, your mental health struggles in the context of trauma. Now, there are many other approaches to it, but even there may be a distinguishment between trauma therapy and trauma-informed therapy.
Yeah, what is the difference? Because I've heard it said both ways.
Yeah, and I don't think it's probably as different as we think, but so they often caution people who are looking for a therapist, if it only says trauma informed, are they saying that, okay, I kind of sprinkle in trauma awareness, or I just sprinkle in some trauma elements, versus trauma therapy is saying everything that we are doing is dedicated to addressing the trauma. How we conceptualize why someone is struggling through the lens of trauma, how we treat it is specifically treating the trauma. So instead of just trauma informed, of sprinkling some aspects of that. Sometimes with therapists, if they say trauma informed, it may just mean I've kind of did my own studies on that, versus trauma therapists may say I have sought out training to specialize in those areas. And I really have a deep understanding and ability and competence to treat trauma.
Okay, thank you. You said you talked about a patient you've seen for years. Does it really take that long to get better and heal?
Yes.
Oh, no.
And the oh no that we often respond with is because we live in a microwave society. We want things fast. And this is why I'm often skeptical about things that promise in mental health to address or to, cure someone quickly. It's very obvious when you look at, different modalities and different therapy approaches, that healing is a journey. And I really believe that although people can make significant, headway in therapy, that we're always healing. I think we're healing till the day we die. Now, we can have concentrated amounts of healing, but it really is a journey. It can take years. Some people, depending on where they're at, they might come into therapy at the very beginning of their journey. So it's going to take longer for us than someone who's already, maybe halfway through their journey, meaning they've learned about trauma, or they're very self-reflective, they're already more aware. So depending on where you start, think about a baby. A baby has a whole life to learn so many things, right? Versus an adult. They don't have to learn how to walk anymore. Well, in general. But yes, it's a journey and it can take some time. And that's why patience is really important as you begin your healing journey, is to allow yourself the time necessary. And if you think about it, I like to define perfection as growth. People are like, oh, am I doing this right? As long as you are growing one foot in front of the other, don't rush the healing journey.
Oh boy. Why is it not productive I have a friend who I believe has had significant trauma, and although different than mine, she often says, well, it wasn't as bad as what happened to you. Why is it not useful to compare yourself and your trauma to somebody else's that you may perceive as not as significant?
So we have a tendency to either minimize or magnify, right? So when we compare, some people have the tendency to minimize their own sufferings. I'm fine, I'm okay, or, it's not as bad as so and so. Or, sometimes parents have done this of like, oh, you shouldn't complain because there are children in Africa, right? We heard that said a lot. And we minimize our experience. And I'll come back to that. Magnifying our experience, oh, it's worse for me. And we can't compare, because when we compare, whether minimizing or magnifying, we're not accurately defining what happened. We need to take trauma as it is. And for me, if I've experienced trauma and how it is for me, it's important for me to recognize where it's at, regardless of how it is for Chef AJ or for someone else, right? So I need to take it as it is, because then I know what to do with it. But also think about, there is a very subjective component of suffering. In Viktor Frankl's book, The Man's Search for Meaning, he uses the analogy, and he talks about how you can't compare suffering as suffering being a gas in a room. That when you emit a gas into a room, it evenly distributes, regardless of the size of the room, meaning suffering impacts all of us and we can't compare. We do this often, and here's a practical example of a child scrapes their knee, right, and they're crying. We wouldn't go to them and say, well, maybe some people might, but they're like, suck it up, kid. I broke my arm. Like, mine's worse. No, because for that child, that pain is legitimate. And so comparing whether by minimization or magnification doesn't help us actually take the steps necessary to heal our trauma as it is.
Okay. Well, it's probably not good in any area of life, really, to be comparing yourself to others.
Yes.
Yeah. And like you said at the beginning, two people could go through the same experience, like 9/11 or even the Holocaust, and have a completely different. What do you think sets people up for that? Like differences in nervous systems? Because I hear a lot these days about something called nervous system regulation. And some people
Mhm.
just seem to be more sensitive than others with everything. Some people are thrilled if they could jump out of a plane. That would scare me to death.
So there's an element of which we could be born with more or less sensitivity, emotional sensitivity. Uh, and that is not, I don't want people to hear that and be like, oh, okay, it's all about being born that way. No, we could be born with that. But this is actually a theory that's emphasized in DBT called the biosocial theory. The bio part is some of us are born with emotional sensitivity. And that's where, we talk a lot about temperaments, or parents might say, oh, yeah, you were a baby like this, right? Crying a lot or very sensitive. Some of us may be born with already differences in that. Now, that is not the main or only factor. It then depends on our environment. That's the social piece. Was I born into a family that recognizes that sensitivity and helps me learn how to regulate that nervous system? Or was I born into a family or an environment that doesn't teach me how to deal with that? And if it's the latter, sometimes we call it an invalidating environment or an ineffective environment. If we are born into that environment, then that magnifies the sensitivity. So if I already sensitive and let's say I'm an emotional child, and then I have a parent that's very invalidating and tells me to suck it up or tells me to suppress my emotions. Anytime I suppress my emotions, it's like a pressure cooker that builds and then I'll explode, which then is like, oh, look, see, I am sensitive. And it's like, no, that part is actually because you haven't been taught. And so there are some people, yes, born with some sensitivity, but it really depends on their environment. And there's been a lot of research studies that have been done where they look especially at the first years of life. And if children have really healthy attachment in the first years of life, they go on to have regulated nervous systems, right? They go on to have more successful mental and even in other areas of life, but in their mental health, they have a stable mental well-being. So definitely there could be sensitivity, but a lot of it does have to do with environment and attachment.
Well, all these things I've been hearing lately about, somatic experience and internal family systems, brain spotting, EMDR, nervous system regulation, are any of those useful, or do you still have to get to the root first and then do those modalities to heal?
Yeah, so you just named a lot of modalities. So my response isn't going to address all of them because some of them are different. But I think you're kind of capturing some of the somatic ones and some of the ones that are more skills based versus, as you mentioned, getting to the root. So those are definitely helpful. And actually, going back to when I mentioned the three stages of recovery, the first one, safety and stability, that's where some of these therapies, especially somatic therapy, can be extremely helpful. Sometimes what we do is we jump into deep healing or attempting deep healing, going to the root first, and that's too hard for people. They don't have the skill set yet. They don't have the ability to regulate. So think about if I'm bringing up a significant trauma memory, but the person doesn't even know how to regulate their emotions and know how to self-soothe, I'm putting them in more distress before giving them the tools to know what to do with that distress. So those therapies, especially like highlighting the somatic therapy, has its place early on to help really people be equipped with skills to be able to regulate and really to build muscles strong enough to dig out the root later on. Some therapies, though, however, and some people only do those therapies, but they don't move on to the second stage of remembrance and mourning and getting to the deeper root. So we really need, this happens a lot with therapies, is it approaches or addresses one aspect of healing. And so we need more comprehensive healing. And that includes, yes, learning to regulate the nervous system and having skills. I sometimes do DBT before I might do CPT with someone so that they have more of that stability and that foundation before they get to the root.
Yeah, I tried them all, and if they work for people, that's great. But I tried brain spotting, IFS, EMDR, and it's like the song and chorus line. I literally felt nothing. I wanted it to work because it was affordable, it was, non-invasive, but and tapping, it just did not work on me.
Mhm.
Yeah. What do you think of IFS in general? One of the live viewers is asking.
Again, I think a lot of modalities, right, and approaches address a specific aspect. What I really love about IFS is the integration part of trying to make someone more whole. And there's a lot of things that we do, like self-blame and shaming ourselves, that um, keeps us, like going back to what I mentioned about the definition of trauma being the rupturing of relationships, is it keeps us from even integrating with ourselves or reconnecting with ourselves. So I definitely think that there's a part of that that's really helpful for people to reconnect with themselves and others. I don't think it's comprehensive enough to go into all the aspects of trauma, but I do think that it can have its place, and especially in that reconnecting with self.
Thank you. Here's a question from a viewer. Let me just pull it up. It just came in. Okay. So this is from Faith. Where did it go? Okay, sorry. Should maybe go to that's what happens when people text me. Let me go to another one before, and then I'll find this one. But one of the ones that I want to get to, and it was going to be one of the last ones, is like, how do people even find a trauma therapist, and how do you know it's a good one or that therapy is even working?
So I almost wish you didn't ask me that.
Okay, delete, delete.
No, just because it is very hard. And it's a part of like my own struggle when people ask me like, oh, okay, I can't see you. Can I see someone else? Right. I had a 2-year wait list and I was when people would ask me, well, if I can't see you, who else? And it's this constant struggle because of just the number, right? The ratio of how many people have trauma versus how many trauma therapists there are. It's an incongruent. Um, it's not conducive to everyone finding a trauma therapist. But some practical things that maybe can help to some degree. And I don't want to make it sound like it's a hopeless endeavor, but some things that people can do is they can go to platforms like Psychology Today. They can call their insurance, and um, on those platforms or calling your insurance, read profiles. Therapists often have bios or profiles that indicate whether or not they are a trauma therapist or trauma informed. Sometimes they may use the language of like they address a lot of attachment issues. That could also be if your trauma is related to attachment. But at reading profiles and really educating yourself about the individual. And then I like to tell people this is in general for all kind of attempts to find a therapist in general, but can also be specific to a trauma therapist, is you don't have to marry your therapist. So you can date, meaning you can go to a therapist, you can ask them, I have this trauma, and interview them. What is your approach? Because maybe they didn't advertise per se as a trauma therapist. But maybe they can be equipped to help you with your trauma. And so, without knowing definitively, sometimes maybe we definitively know because it's on their profile, but if we don't know, go and interview them. And I really want to emphasize that because too many people, they get set up with a therapist, they think they're married to them, and they think that the first session is just the therapist asking them questions. But I want to empower people to ask their therapist questions, especially the first meeting. You do not need to stay with them. And so if you ask them, hey, what's your approach to trauma? Do you implement, any sort of modality? Ask them about which ones they use. And if they use all these acronyms like CPT, DBT, you have no idea, ask them to explain it to you. But you want to feel really confident that whatever trauma you're bringing into the therapy, that they can help you with that.
Thank you. I found Faith's question. What tools do you find the most effective for controlling and hypervigilant personalities?
So I hope this isn't a question about other people's hypervigilant
No,
personalities,
it's
but
about
our
her.
own.
It's about her. Yeah.
Okay, okay. So read it one more time so I can let it sink in.
Oh gosh, I just closed it. You can't
No
believe.
worries. Okay, so
Oh no, and it was so hard to find.
with tips
What
with
tools do you recommend? Oh, here. What tools do you find most effective for controlling and hypervigilant personalities?
okay. So again, thinking about roots, like, oh, what's the root of that? Now we could do some superficial techniques of like exposure therapy. That would be probably the go-to kind of immediate things that we could do to try to eradicate that. But also thinking about the roots. What made me hypervigilant? What made me control? What am I afraid of that leads to these behaviors? Going back to some of the core elements of several therapies is there's this triangle that has thoughts, emotions, and behaviors. And thoughts, emotions, behaviors are in a triangle because they're all linked, they're all important. And so we may say hypervigilance and control would be a behavior. So, what do I need to change in my thoughts and my emotions in order to reduce that behavior? Are there thoughts of, I'm, if I don't, if I'm not hypervigilant, I'm going to, I'm in danger. the world is a dangerous place. I'm powerless to these things. And so those thoughts will lead to hypervigilance. I had a client recently who it just kind of came out. She's like, if I don't control, everything will fall apart. Right? That's a thought that she really believes, and that's going to continue her controlling behavior. So looking at the thoughts, what are my emotions whenever I'm highly anxious? This is a classic OCD thing as well. When I'm anxious and I have the obsessive thoughts, I'll lead to a compulsion that is of control. So understanding, okay, how do I address the underlying thoughts, the underlying emotions, but then again, the underlying trauma? Am I trying to control because I once suffered from, years of someone hurting me and I felt powerless in those experiences. And so now I've overcompensated. Now I'm over controlling. No one's going to hurt me again. Or with hypervigilance, was I in a situation? This is a classic example of individuals who develop hypervigilance. Was I in a childhood environment that was so chaotic? Did I have an alcoholic father, for example, that trained my brain? You have to be hypervigilant. And what I like to often say is that a lot of our bad behaviors are really things that we learned at some point that were adaptive, but it's no longer necessary or adaptive in our lives today. And it's causing more problems than it's helping. And that's often with control and hypervigilance. So changing the thoughts, regulating the emotions that lead to those behaviors, but then also trying to understand and address the underlying trauma.
You mentioned OCD. Does that and perhaps other mental illnesses also have its roots in trauma?
Yes. So OCD, CBT works really well for OCD, and you can really extinguish a lot of fears and even obsessions with that. But I've often seen that it's lacking in treatment when we don't address the underlying trauma. Because sometimes what happens is someone might say, okay, I'm not controlling in that aspect anymore, but then it pops up in another area, right? It kind of transfers. So we have to understand, why did my brain develop this, when did it, and then why did it develop this cycle of I have this, fear, this obsession that then leads me to compulsion? What trauma has fed that? So without a doubt, you'll notice my answers keep on coming back to mental illness is very much so rooted in trauma.
Thank you. What got you so interested in this field? Did you have trauma yourself, if I'm allowed to ask?
You are allowed to ask. So multiple things. The primary thing, which I didn't even actually recognize until later, was my father experienced trauma. So a very brief kind of summary of my father's trauma and his story is my father was born in Brazil. He was born and very early on, just as a baby, his mother abandoned him to a family member's home. So first trauma, right? Abandonment. My mom doesn't want me, being rejected and abandoned. And then his aunt had her own children and mistreated him. And shortly after that, sent him to an orphanage. And you can only imagine, the traumas that orphans endure, especially in another country and at that time. And then he went through multiple orphanages. And then at the age of 16, he was out on the streets of Brazil on his own. And so you can imagine another trauma, right? Just multiple traumas throughout his life. And it's really a beautiful story, one that I often share when I'm talking about trauma healing and the beauty of and the possibility of trauma healing, is that he was then at that age 16 introduced to God and to the Bible, and he read this verse that says, though a nursing mother may forget her child, I will never forget you, says the Lord. And that started to heal his attachment as he got closer to God. Later on, got married, started having his children. And so myself, my father, shared a lot of his story, but also the way that he saw the world and the way that he thought about the world. He later became a pastor. And now as a pastor's kid, I'm in this environment of seeing a lot of broken people. And my father really shaped us to understand, not to judge the broken people, but to understand them. And I think this conceptualization, I'd say our lunch and our dinner time with our family was like conceptualization, understanding people. Why do they do what they do? It's like Oprah Winfrey's and Dr. Bruce Perry's book on what happened to you, not what's wrong with you, what happened to you. And I think that that question was a constant conversation we had about people and understanding what happened in the church. And they say a lot of pastors' kids leave the church. But my experience was, oh, I understand why there's hypocrisy. I understand that there's brokenness. And I really do believe that home environment shaped that desire, because my sister went on to become a marriage and family therapist. So definitely something in the air in our home environment. But it wasn't until, so that's kind of what got me into mental health. But I had a strong passion for physical health. I thought about becoming a PT. I thought about becoming a dietitian. And when I started realizing in graduate school this connection between mental health and physical health, I started doing a lot of my training in hospital settings. I was in primary care settings of helping patients who had diabetes and comorbid depression, individuals who had chronic pain disorders with psychological disorders, and just this overlap between physical and mental health. And that's where I started to see trauma. I was like, oh, what's underlying the obesity as well as the depression? Trauma. Oh, they were, continuously raped as a child. And so they put on all this weight to protect themselves. And then they also developed this depression. Okay. And I started to see it. And then later on in my training, I specialized more in the VA setting, where I really saw trauma as the root to a lot of challenges, and both physical and mental health challenges. And that's where I never went back. I was like, yes, I need to continue to address the root of trauma.
So Dr. Brooke Goldner has a regular spot monthly on my show, and she's actually a psychiatrist. And she just talked about this week how people that have trauma have an increased incidence of autoimmune disease and cancer. So how can unhealed trauma or just trauma, affect our physical health? Because I'm thinking that's why I got lung cancer, because the diet has been dialed in for a really long time, the exercise, the lifestyle, you know.
So going back to my answer about childhood impact, we went through some of those hormonal changes, right? Prolonged and chronic elements of that. We talked about the immune system changes, the wear and tear that this has. Two great resources on this topic would be The Body Keeps the Score, which is probably the most popular one, by Vanderbilt. But then also one that's probably not as common, but he's popular, but I think this book is not as popular, is Gabor Mate's book on When the Body Says No. And I really appreciate his outlook on this. He talks about even like people pleasers tend to have certain diseases, and because many times these traumas create this vulnerability in our body. So it doesn't directly, one for one cause these issues, but it really weakens our system, causes us to be very vulnerable in a way that he says, like, if we don't say no to things, because of trauma or whatever, our body will start saying no for us. And I really appreciate that perspective. And we can see this a lot in this pattern, but we see it's very clear. And Gabor Mate also highlights this in The Myth of Normal and other parts of his other books, because it's a repetitious pattern that our trauma makes us vulnerable in ways that we can develop these issues. I'm going to actually pull up a quote by him that I think is helpful. I won't share my screen, but I'll just find it and read it, because it's really powerful of how he says this, of the connection. Let's see here. Here we go. It's from When the Body Says No. There's not a single disease in existence that is not affected by our emotional state, right? And that's like a very strong statement. Not a single disease. Disease, in other words, is not a simple result of some external attack, but develops in a vulnerable host in whom the internal environment has become disordered. And then in my own words, disease doesn't simply come from external threats like pathogens, toxins. That's how we think about disease. It arises in a body that's already vulnerable, And vulnerability comes from chronic stress, emotional repression, unhealed trauma, the body's inability to repair itself or regulate cell growth properly. And that, I would say, like, is the biggest connection that we can see between physical and mental health, or
Thank you.
illness, I should say.
People are asking if you do telemedicine and if you take insurance.
So we do telemedicine, virtual therapy here at Beautiful Minds. I myself am not taking on any clients for two reasons. One, that as I mentioned earlier, I have a long wait list. But two, I'm currently pregnant, so you can't see in a virtual setting. So I'll be taking maternity leave. I think the questions are asked in a way that they're wanting to see if I could see them. So unfortunately, I cannot. But there are other wonderful qualified professionals, including some people here at my practice as well.
Thank you. I'm not sure how to exactly phrase this question, but there are some people I know that don't believe in trauma. And what I mean by that is they don't believe that a person had a traumatic experience, but they don't seem to believe that it impacts the life in a meaningful way, all things considered. I'm wondering why some people think that, and is there even a way to respond to somebody that thinks that what happened to you really doesn't matter, that that I,
My immediate response is, especially because it's so obvious to me that it is real, legitimate, and impacts, that my brain for a moment has like this pause, like, I have no idea why they would think that, right? It would be best to just ask them, right? Um, the evidence is so clear that I really don't understand, in light of that evidence, how someone could believe that. And so it can't be in light of the evidence. It must be other reasons. And some of those other reasons is it's a comfortable truth, their truth, that helps them to cope. So you might ask, how could it be beneficial for that person to avoid trauma, to not avoid, dismiss it? Well, they may be fighting against the discomfort of people who have been victim mentalities. And so they're like, oh, it's not a thing. And they're over correcting from that. Or they might say, oh, I had my trauma myself, but I've been strong and I've been okay, so it's not a thing. But that's also a repression of their own experience. And I would question, as a therapist, whether or not they really are okay. And so I don't know all the reasons, and I could probably take time to like think through a buffet of options, but I think in some ways it's a helpful, comfortable repression and just dismissal that keeps them in their own reality that's more comfortable for them.
thank you. How can somebody tell the difference between like a real present life danger and a trauma trigger?
That's a great question. And that's a really great question, because so much of therapy is helping people to distinguish between past and present. Because you're spot on that when we experience, a trigger, it feels really real. It feels as if there's danger in that moment. And so we need to really distinguish between what's past and what's present. So when we think about a present trigger, we have to first look at the evidence. We sometimes use this term in DBT, check the facts. Is, okay, I have this trigger, I have this physical response. Okay, that's fine. We don't need to dismiss that physical response, but we need to check, is this response because of past or present? And part of the question is, look at the evidence. So you might say, okay, let's maybe use an example. You see a snake, right? And your body, gets sure, oh, it's a snake. Oh, it's a rattlesnake. Evidence shows, yes, there is present danger. Also think about evidence being as observable facts. If I'm having a trigger at the supermarket and I'm saying, oh, I'm about to have a panic attack. Well, what's the evidence that I'm unsafe? So first off, check the facts. What is happening right now? Not what happened in the past. Oh, this person feels unsafe. I hear a lot of my clients say that. Oh, it feels. What is actually happening right now? So we first look at the evidence, but not just evidence. We also need to look at the probability of something happening. Because a lot of times past trauma makes us think and feel as if something is very likely. So I had a car accident and then I'm afraid of driving. Okay, yes, it's possible to have another car accident, but it doesn't mean that it's likely. We oftentimes, with current triggers, overestimate the risk. I like to use the analogy of a fire alarm, that when a fire alarm is extra sensitive, aka past trauma, it will alarm sound when it even has a scent of burnt toast. Now, we don't get rid of the fire alarm, but we have to distinguish, oh, my fire alarm's sensitive. I have trauma triggers. I'm sensitive. Is this present? Is there a flame in my house? I have to look at the evidence and what's happening now versus what happened in the past.
Thank you. Vi, who's watching live, says, so is most mental illness caused by trauma? What about chemical imbalances in the brain? There's a bunch of people that don't believe that, actually.
Yeah, there is some kind of pushback on this older theory of just chemical imbalances. Now, I did mention earlier about the sensitivity that we can be born with, certain genes, but remember, epigenetics is this idea that we can turn on or off genes by experiences. So even if there is a chemical imbalance, or even if there are elements, biological or physiological elements, there's so much in our control, right? So much that we can do to cope. Both, it's the idea of neuroplasticity as well, the ability for our brain to rewire itself. So if it was really just chemical imbalances, well, actually, let me add this to that. What impacts chemicals? Our choices, our thinking patterns, health, diet, exercise. So many times people think chemicals are simply impacted by medication, but our hormones, things like serotonin, dopamine, oxytocin, are impacted by multiple things. So even using that question, which I appreciate, because I think that's still lingering and causes some of the stigma, that it's only something that you're born with and you're stuck with. But so much of the science tells us we might have some elements of biology or physiology, but there's so many choices that we can make that can change our chemicals. And we're not just so simple as human beings that we're just chemicals.
Thank you. If somebody either can't find a therapist or can't afford therapy, are there things people can do just to start healing?
This is one of the reasons why I do a lot of the podcast, why I do a lot of public speaking, because I know some people can't access that. And so I really encourage people to take certain steps. I have some talks also, it'll be in the link of the show notes of, it's on Audioverse, where I've done thorough presentations on trauma and trauma recovery, but I'll just highlight a couple of those elements. One of the elements is research shows that what predicts the best predictor for success in therapy is not the therapist, is not the modality, although those are important. It's how committed a client is to healing. So if you don't have access to therapy, what I encourage people to do is, number one, be super hungry for healing. Just that alone, people will take leaps and bounds in their healing. What that then translates to is people are so hungry, they're going to start educating themselves. Read books. There are wonderful books, podcasts. Saturate your mind with resources all about trauma. The book, What Happened to You, what I just referenced not too long ago, that's a great resource. Just so many good books that can educate, one, giving them the awareness. It's as if they're talking to a therapist, but instead of the therapist highlighting things, a book might. I also encourage not just reading and podcasts, but workbooks. I have known people who have had significant healing even outside of therapy in ways that were attributed to these resources. I also highly encourage, if trauma is the rupturing of relationships, then steps people can take now without therapy is reconnection, which is the third stage of healing. connect more with people, but safe people. If you're like, oh, I don't know too many safe people, just find one and start connecting more. If you have a rupture of relationship with God, find a safe avenue to start exploring that more. If you have a ruptured relationship with yourself, how can I start treating myself better, self-soothing and doing other things? But if you're committed and desperately hungry for healing, there are so many resources. Therapy is just one. It's not the thing. It's not like you can't have healing without it. That's the pendulum swinging to say like, oh, now we don't have as much stigma about therapy and we all need therapy and we have to have therapy. No, we can find therapy through life experiences and through other resources as well.
Thank you. What are some signs that therapy is actually working?
So the way to answer that would be kind of doing the opposite of take all of your problems, your symptoms, your struggles, and then say, okay, those are becoming less. So for example, if you have a lot of addictions, if therapy is helping, those addictions should start to get less and less. If you have really strong emotions, those emotions should become more manageable. If you have really distorted thoughts, extreme thoughts, those thoughts should go down. And think about maybe in all these things I've mentioned, decrease in frequency and decrease in intensity. I'm not saying that if therapy is helping that they're eliminated, but we start to see the frequency and intensity of these things start to diminish. We can also talk about improvement in quality of life. I'm starting to connect more with people. I'm starting to do things that I love more. Now, I just want to put a caveat here, though, is sometimes we say, oh, therapy is not working, but you have to keep in mind, why is it not working? Is it the therapist or is it you? There are times where clients have told me, oh, therapy, I've been in therapy forever, it's not working. And I have to kind of gently say something along the lines of, have you been doing the things I'm recommending? Have you been implementing these things? So just be mindful, like when you're trying to assess whether or not it's working, if you're fully committed and you're fully involved, then yes, if it's not showing these signs of improvement, then it's good to look for another therapist. Or at first, don't look for another therapist. Tell the therapist it's not working and try to work through it. But if you're not committed, if you're not invested, don't just immediately blame therapy. Take a look within.
Thank you. How does one articulate their mental health needs to people that are not in that space that don't understand it, or they don't have the patience or the compassion for it? Like when you go to the ER, you have panic disorder, but that's not why you're at the ER, for example.
That's a really good practical question, right? Because when you do have mental health issues, it impacts a lot of different aspects of life. And so we want to be able to try to communicate that well. Just know that even if I answer like, oh, these are the strategies of how to communicate well, one thing to keep in mind is you can communicate something very well, but you have to also assess, is this person willing to listen? So now we don't always know, but you can try, right? But just keep that in mind because sometimes we are disappointed by people or we're hurt by people like, oh, they didn't listen to my mental health needs or they didn't understand. But some people are not capable or demonstrate that they're not willing to listen. So, other than that, so let's say, assuming that they are capable or willing, um, first off, we have to understand our issues ourselves. And so if we don't understand it ourselves, it's going to be harder to communicate. So that would be the first step. As we understand more of, okay, I have panic attacks and these are my triggers and so forth, then we can go, let's say, to a medical professional and say, Dr. So-and-so, I'm electing to have this procedure. I want you to know that I struggle with panic disorder and these are my triggers. And so I'm concerned about this coming up in relation to this procedure, right? Try as much as possible to remain factual, to be concise, because we have to think about the objective of why I'm communicating that. Sometimes we go in and we just want to blurt it all out or overly express, and then that can make someone respond in a way that's not helpful. It's just us understanding and then communicating it in more of an objective way, and then seeing if they ask more questions to elaborate, but we also don't need to overshare.
Yeah, Thank you. What is one daily practice you might recommend for someone to move from trauma to transformation?
One. Ooh, that's tough,
Or
right?
okay, all right, three. How
Three.
about
Okay.
three?
Still tough, but
Okay, 10.
um, maybe it's not like a specific practice, but it's more of a mindset that, and all the things we talked about that's helpful, and all the things maybe that you learned that are helpful for trauma to and leading us from trauma to transformation would be doing things small, because it's a journey. That whatever the daily practice is that you choose to do, start small. And I say that because that is more sustainable and can lead to more progress than what I typically see people doing, is doing things that are too big, not accomplishing their goals, and then feeling defeated and giving up. So doing something small, and I would add to that too, doing something you want to do. So if part of trauma to transformation could include exercise, can include changing your diet, can include uh, journaling, that those are all great daily practices, and all of them would be helpful. But what's something that you want to do, that you have buy-in for, and then starting small, biggest bang for your buck, right? Lowest hanging fruit. Those kinds of things would be more helpful for you than if I just said, do this one thing, like deep breathing. Like deep breathing is great, but if you don't have buy-in for it, it's not going to be great for you. So those would be the principles. I don't know if that was one or three or five.
Are you going to write a book?
I do plan. I started one when I was, yeah, long story for that. But the one that I really do want to write is parts of the story of my father, and kind of the lens of a psychologist, now understanding her father after learning some of these things, and then how his own personal story of healing highlights different elements of trauma healing as well. So that's definitely something I want to do for sure.
Can trauma show up in someone's daily life even if they don't realize it's trauma?
Of course. So think about it in the analogy of like a tree, right? There are things that could be growing underneath the surface and you have no idea, and but you see fruits. And there's a quote that says something along the lines of, if you want to change the fruits, you must first change the roots. If you want to change the visible, you must change the invisible. So many times what you're highlighting is trauma can be invisible, whether that's because we've suppressed it. And I've had clients who say, yes, it really is gone. And I'm like, well, you have the fruits of addiction, you have the fruits of these other things. I don't know if it's gone. Or sometimes by that one's by repression, intentional repression. Other times we just really don't have that awareness. And so it definitely can.
I wonder, is it ever too late to heal? The reason I bring that up is last year I did two trauma retreats, in person ones. One was called Rachel's Vineyard. One of the viewers recommended this to me. This was for people that had miscarriages or abortions. This was a weekend. And then I did a week-long one called From Grief to Grace. And there were people in that were very young, meaning like in their 20s, that maybe just experienced the trauma. And there were people there like in their 70s that
Wow.
for the first time. And I'm wondering, like, does it matter how long you've had it? Does that affect your ability to heal? Because obviously it'd be good to do it. It's just, this wasn't a thing when I grew up. It was just that I came from the generation of you pull yourself up by your bootstraps. And so nobody was talking about ACEs or trauma. So my question is it ever too late?
It's never too late. I've had clients, I think the oldest client I've had was 80 something years old. Never too late. And also, we have to realize that just because you didn't have therapy or a retreat, you were healing already. Like clients come to me and they've had through life experiences, or people like, you get married to someone, you have a precious dog, right? Different elements where you can already, you don't even realize you've already been healing. Then you say, okay, is it ever too late to take the next step of healing? And even, Chef AJ, you were on our podcast not too long ago. And I even was thinking in one of the questions that I had asked you about how your own journey of becoming plant-based, and first, like, even the, unhealthy junk food vegan, to then the healthy plant-based person. all of that was also part of your trauma healing. We didn't call it trauma therapy. You didn't go to a trauma retreat, but that was a part of your journey. And so it's never late because we continue to build off of what came before. Now, some people say, oh, well, Katie, I've had these beliefs for 70 years. Does that mean it's going to take 70 more years for me to unlearn them? Right? This idea, it's too late. But because our brain and our bodies are designed to heal, right? To heal itself, to neuroplasticity, old dogs can learn new tricks. And so it doesn't matter when you start, and whether you're a child and you don't have a fully developed brain, well, we can still help you in that development. Adults have something one up from children. They don't have as much time, but they do have a more fully developed brain that can also accelerate the therapy as well, and as well as other life experiences. And so a 70-year-old might actually make more progress than a 30-year-old, right? So it's never too late. And everyone deserves at any point in their life to experience a better quality of life, no matter where they're at.
Is trauma therapy something always delivered one-on-one, or is it ever done in a group setting?
It can be developed. It can be done in a group setting. It's done differently, especially because you often don't want to process the trauma in a group setting because it can be traumatizing and triggering for other group members. So they'll have different kinds of trauma groups. Some of the trauma groups might be focused on just learning basic skills and it's more educational. There may be a trauma group uh, on nightmares, how to learn how to overcome nightmares. It might be a lot of them, I would say, is skills focused because there's a danger in trying to process traumas that can then be traumatizing for other people. So I highly recommend group with individual if possible. So you learn skills and you have some things from the group, but then you also have an individual space where you can process more thoroughly.
If somebody wants to just start exploring this, maybe they're not sure they've had trauma. You mentioned three books, The Body Keeps the Score by Bessel, I can't, how do you say his last name? Vander Wark, I think.
Yep. Uh-huh.
What Happened to You by Oprah Winfrey and a psychiatrist whose name escapes me right now, and Gabor Mate, The Body Knows. Are there any other books or resources that you might recommend to people?
So those are the main ones. Now, I sometimes have other specific ones depending on the person. For example, The Wounded Heart is one on specifically childhood sexual abuse. So the ones you just mentioned can be really applicable to all people. The Wounded Heart is really helpful for victims of childhood sexual abuse. And then also it takes a Christian perspective. So if a client's like, no, I want nothing to do with that, right? I wouldn't recommend that book. And then it has a workbook that's excellent as well. So even if you're not Christian, it's a great book. It's specific to that topic. Another one that is more specific if someone's like, I'm trying to heal my wounds, my spiritual wounds, right? There's different books on religious trauma and so forth. There's a wonderful book called The Hidden Half of the Gospel. So if someone believes in Jesus, it looks at Jesus's trauma in relation to their trauma. It's written by both a pastor and he's also a marriage and family therapist. So there are some that are a little bit more specific, but I would say the more broad ones, the main authors that are recommended is Dr. Bruce Perry, he's the child psychiatrist, Dr. Vandergold, which you had just mentioned, Dr. Gabor Mate, and then Dr. Judith Herman is an excellent resource, but she typically writes to clinicians and a little bit more in depth, not very patient friendly. And let me see if I'm missing anyone else. Peter Levine, Dr. Peter Levine. He's another big one. If some people want to take just a general lens to attachment, How We Love is a great resource. But yeah, those are just a few of many that are the top ones.
Thank you. Is there anything else you'd like the audience to know, either about trauma or trauma therapy or yourself? I know you have a podcast. I'm guessing that's where people can follow you. I don't know if you have any social media accounts where you interact with people.
Yeah, so all of the resources will be in the notes, whether I've recommended certain podcast episodes highlighting trauma, CPT, complex PTSD. So if they want more information about that, they can go directly to those links. The Brain People podcast in general. There are some of the podcast episodes that may not, be obviously related to trauma, but could be very beneficial for trauma healing. For example, there's one that talks about our worth. Um, Trauma really attacks our sense of worth and our self-esteem. And so that's one of my favorite podcast episodes of how we can establish a healthy sense of self-worth. And then there's one that I also really love of befriending your emotions. That one talks about how a lot of times we disconnect from our own bodies and we hate our emotions. I'm trying to get rid of anxiety, trying to get rid of depression, but they can actually be signals and they can be our friends. Oh, and then the other one, the other great podcast episode is radical acceptance, is how can we learn to radically accept the different things in our lives, not just traumas, although that would really apply, and forgiveness is related to that. There's also an episode on forgiveness, which is a key component of trauma healing, but also it helps us radically accept the common triggers that we have, like road rage or other things. It's similar to like the Let Them by Mel Robbins theory, but those episodes are really helpful. And then I included some other links, including one that if people want more of the integration between faith and trauma or faith and mental health, I did a series with my sister on the Bible and CBT. So just for people to explore if they want more, I tend to do a lot of digital resources, but hopefully one day soon, Chef AJ, you could keep me accountable of me actually writing that book.
Well, you got maternity leave now. Do it now.
Right? Baby in one hand, typing in another.
Just talking to like a little talking to your iPhone. Well, thank you so much, Dr. Cruz. This was very informative. I really appreciate it.
Yes, thank you for having me on being able to talk about something that I'm very passionate about.
Yes, you clearly are. Thank you. And thanks to all of you for watching another episode of Chef AJ and Friends. Please come back tomorrow at 10 a.m. Pacific time with a different Katie. This is Katie Schlerer from the restaurant in Auburn called Nectar Cafe. Have you been there, Dr. Cruz? It's one of the
I
best.
have. I go there regularly.
Oh my
Yes.
gosh, the best because we've lost 9 restaurants in the last 4 years, vegan or vegan friendly. So it's pretty much the best one standing.